Hey everyone, and welcome to today's Explainer. I am absolutely thrilled you're joining me because today we are taking on a massive, incredibly important topic, and we're going to completely demystify it. We are looking at lung cancer. To give you a sense of scale, if you were to unfold all the microscopic air sacs inside your lungs, they'd literally cover an entire tennis court. It's a vast, super complex network. And that's exactly why we're taking this complete medical journey together today, starting from that tiny microscopic world of cellular biology all the way through to modern, incredibly hopeful survivorship outcomes. Whether you're a student, a caregiver, or just someone who's fascinated by how the human body works, this explainer is going to give you a crystal clear understanding of exactly what this disease is, and more importantly, how modern medicine is fighting back.
Okay, let's dive right into this. Here is our roadmap for today. We'll start off with the biology, then move into risks and recognition. After that, we'll cover detection and staging, explore modern treatments, and finally, look at the road ahead.
All right, part one, the biology, anatomy, and cell mutations. To really grasp this, we have to zoom way in.
When you look at healthy versus cancerous lung tissue, the contrast is just stark. On the left side, you've got normal bronchial epithelial cells. These guys follow strict rules, you know? They have a perfectly controlled cell cycle and normal DNA repair mechanisms to keep everything in check for healthy gas exchange. But on the right, things have gone completely off the rails. Due to DNA mutations, the genes that are supposed to suppress tumors just fail, and oncogenes, which are essentially the accelerators for cell division, become hyperactive. These abnormal cells start multiplying totally out of control. And this brilliantly shows a really crucial concept called angiogenesis. Basically, these rogue cells literally force your body to create a brand new blood supply just to feed the growing tumor. That right there is the fundamental biology of cancer.
Now, you might be wondering, is all lung cancer the same? Actually, no. Oncologists broadly divide the disease into two main camps. First, there's non-small cell lung cancer, or NSCLC, which honestly accounts for the vast majority of cases. This includes subtypes like adenocarcinoma, that's the most common one, and squamous cell carcinoma. On the flip side, small cell lung cancer is distinctly different because of its neuroendocrine origin. It's known for extremely rapid growth and early metastasis, meaning it spreads to other parts of the body really fast. Understanding this difference, it's the absolute first key to figuring out how to fight it.
Moving on to Section 2, Risks and Recognition. Let's talk about causes, prevention, and symptoms.
So I want to pose this question directly to you because it tackles one of the biggest myths out there. Can non-smokers develop lung cancer? The answer is a definitive 100% yes. While cigarette smoking is absolutely the most significant risk factor globally, it is far from the only cause. It turns out there are some pretty potent environmental and occupational hazards that can lead to lung cancer, especially adenocarcinoma, even in folks who have never even touched a cigarette. Secondhand smoke is a huge one for sure, but we also see things like radon gas exposure in people's homes, high levels of air pollution, asbestos exposure from certain jobs, and yeah, even genetic susceptibility. The risk profile is way wider than most people realize.
And because those risks are so varied, recognizing the warning signs is absolutely critical. If a tumor starts interfering with how your lungs function, your body is going to send signals. A persistent cough that just won't quit, that is a major red flag. Other signs to watch for include hemoptysis, which is just the medical term for coughing up blood, along with chest pain, shortness of breath for no obvious reason, or sudden unexplained weight loss. If you or someone you love experiences these, please listen to your body and get it checked out. Early recognition literally changes everything.
Let's move right along to Section 3, Detection and Staging. How do doctors actually find the disease?
Okay, this is a massive public health message regarding screening. For eligible high-risk groups, like people with a long history of smoking, routine chest x-rays are actually no longer the recommended standard. They just miss way too much. Instead, the gold standard globally is the low-dose CT, or LDCT scan. This tech is a total game changer. It gives radiologists these incredibly detailed 3D images of the lungs, letting them spot tiny, early-stage nodules before the patient ever feels a single symptom.
So, what happens if they do spot a suspicious nodule? Well, doctors follow a very rigorous step-by-step pipeline. First up is imaging, usually combining CT and sometimes PET scans to pinpoint exactly where the mass is and see if it's active. Step 2 is a biopsy, which is often done through a bronchoscopy, where they guide a tiny camera into the airways to grab a tissue sample. Step 3 is histopathology. That's looking at those cells under a microscope to confirm the exact tumor type. And finally, step 4, which is honestly a modern marvel of oncology, molecular testing.
Let's unpack that last one, because molecular profiling is a piece of medical jargon you definitely want to understand. This involves testing that biopsy sample for specific genetic alterations or biomarkers, stuff like EGFR mutations or ALK rearrangements. Finding these specific biomarkers is the absolute key to modern precision medicine. It's kind of like finding a unique barcode on the cancer cell that tells the doctor exactly which highly targeted weapon to use against it.
Next up, we have the TNM staging system. This is how doctors communicate the spread. T stands for tumor, like how large is the primary mass. N stands for nodes, has the cancer escaped into the nearby lymph nodes? And M stands for metastasis, has the cancer spread to totally different organs like the brain, the bones, or the liver? The really crucial takeaway here is how those TNM factors combine to create a patient's overall stage. Stage 1 means the cancer is localized. It's small, it's confined to the lung, which makes it highly operable. Stage 2 and 3 mean the cancer is regional, so it's reached nearby lymph tissues and needs more complex team-based care. And Stage 4 means the disease is metastatic. It's traveled through the bloodstream to distant sites. Basically, the stage completely dictates the entire treatment strategy.
Which brings us to Section 4, Modern Treatments, the Medical Arsenal. Today, modern multidisciplinary cancer care relies on 4 distinct pillars. First, there's minimally invasive surgery, like a lobectomy using video-assisted thoracoscopic surgery. Then we have radiation therapy to shrink down tumors. Next is traditional platinum-based chemotherapy, which goes after rapidly dividing cells. And finally, the newest frontier, targeted therapy and immunotherapy. Now, keep in mind, treatment is almost never just one of these things. It's usually a highly customized combination put together by a whole board of specialists. Now, what's incredibly fascinating here is how fundamentally different these new therapies are from traditional chemo. Chemotherapy is kind of like a blanket attack on all fast-growing cells in the body, which is why it causes so many side effects. But targeted therapy, that acts like a smart bomb. It specifically attacks the mutated proteins, like that EGFR we talked about found during molecular profiling. Immunotherapy is even wilder. It doesn't actually attack the cancer directly at all. Instead, using things called PD-L1 inhibitors, it essentially unmasks the cancer cells and supercharges the patient's own immune system, so their body can just fight off the tumors naturally. It is absolutely mind-blowing biology. I also really want to clear up a common misconception here. Palliative care is not just end-of-life care. Actually, it is specialized, active medical care focused strictly on providing relief from the symptoms and stress of the illness. Whether a patient is dealing with treatment side effects like nausea or disease symptoms like pain, palliative care runs right alongside curative treatments. It has one primary goal: improving the patient's quality of life every single day.
And finally, Section 5, the road ahead, focusing on survivorship and prevention. Modern survivorship is incredibly holistic. It includes robust pulmonary rehabilitation, where patients actually work with physiotherapists to learn airway clearance techniques and breathing exercises to literally rebuild their lung function. But it's also about targeted nutritional support, occupational therapy to help folks get back to work, and crucial psychological care to navigate the heavy mental health impacts of the journey. And of course, strict supported smoking cessation programs for anyone who needs them. You know, everything we've discussed today isn't just theory. It is firmly anchored in the highest standards of global evidence-based medicine. The guidelines from the World Health Organization, the American Society of Clinical Oncology, and the National Comprehensive Cancer Network, they all independently validate this exact approach. They unanimously agree that the future of lung cancer care absolutely relies on personalized precision medicine, meticulous team planning, and proactive prevention. So I want to leave you with this final, powerful thought. Lung cancer remains one of the world's most serious cancers, but advances have transformed outcomes for many patients. We have seen exactly how today. But as science keeps evolving, you have to wonder, how close are we to a world where a lung cancer diagnosis is no longer a life-threatening crisis, but just a manageable condition? Prioritizing your lung health and advocating for precision medicine are definitely our best tools while we find out. Thank you so much for joining me on this explainer. Stay curious, and I'll catch you on the next one.